Traditional healing methods is a practice that encompasses indigenous methods, ceremonies, and cures like herbs, rituals, and spiritual interventions addressing physical, mental, and spiritual health issues. Good day, everyone. I am Rizeil de Jesus. Together with me is Lyle Calansingin, Clei Carpio, Shaniah Paula Dawa, and Kesha Valerie de la Peña. We are from BSN 3F Group 2A. Today, we are honored to present a topic that delves into the rich cultural tapestry of traditional healing practices in the Philippines, with our study entitled The Utilization of Traditional Healing Methods in Community Health Nursing. As we explore these practices, we will uncover the rationale behind their continued use despite the advent of modern medicine.
For the objectives, this study aims to determine the utilization of traditional healing methods in community health nursing. Specifically, the following questions will be addressed by the study. Number 1, what is the demographic profile of the participants according to age, sex, religion, educational attainment, and socioeconomic status? Number 2, what are the different traditional healing methods preferred by the participants? Number 3, what are the different traditional herbal medicines often used by the participants? Number 4, what are the participants' reason for continuing the use of traditional healing methods? And lastly, number 5, is there a significant relationship between profiles and utilization?
For the methods of the study, the researchers employed a quantitative descriptive correlational study design to investigate the degree of utilization of traditional healing methods in community health nursing. The study's participants primarily came from the residents of Hacienda Carmen, Barangay Granada, utilizes traditional healing methods. The study's sampling technique was a random sampling method. The researchers randomly chose one representative of each household in Hacienda Carmen, Barangay Granada. The random sampling technique guarantees that every individual has an equal probability of being selected for the study. The study instrument was a self-administered researcher-created questionnaire designed to respond to the nature of the problem. The questionnaire has two parts. The part 1 was composed of the respondents' demographic profile, such as age, sex, religion, educational attainment, and socioeconomic status. For the part 2, it was composed of different questions related to the utilization of traditional healing methods.
For the results, respondents' demographic profile in age group 18 to 35 with the 35 participants, 36 to 50 with the 37 participants, 51 to 70 with 49 participants, and 71 to 90 with 17 participants. Next is sex, with the majority of female, with 111 participants, while the male is 27 participants. For the religion, with the highest Roman Catholic, 114 participants, followed by Baptist with 13 participants, Iglesia ni Cristo with only 9 participants, and lastly, Seventh-day of Adventist with only 2 participants. And next is educational attainment, elementary level with 26 participants, high school level with 45 participants, college level with 7 participants, elementary graduate with 11 participants, high school graduate with 29 participants, college graduate with 17 participants, and with a vocational degree is with 3 participants. And lastly, for the monthly family income, with a majority of less than 12,000 is 116 participants. Next is 12,000 to 40,000 with only 16 participants. And lastly is with above 40,000 with 6 participants.
For the table number 2, the utilization of traditional healing methods, for the response of yes, there is a total frequency of 138 and a total percentage of 100%, and none from the participants responded no. For the table number 3, utilization of self-treatment using herbal plants, for the response of yes, there is a frequency of 133 and a percentage of 96%. For the response of no, there is a frequency of 5 with a total percentage of 4%. For the table number 4, consult traditional healers. For the response of yes, there is a frequency of 124 with a total percentage of 90%. For the response of no, there is a frequency of 14 with a total percentage of 10%. For the table number 5, utilization of both self-treatments and consulting with traditional healers. For the response of yes, there is a frequency of 121 with a percentage of 88%. With the response of no, there is a frequency of 17 with a total percentage of 12%. For table number 6, the common illnesses that utilize traditional healing methods, the top 3 is first is cough with 114 with 83%. Second is fever with 104 with 75%, and the third is body ache with 102 with 74%.
As for Table 7, the different traditional healing methods being utilized, the findings show that the top 3 highest, which are the herbal plants, hilot or ablon, and butbut or luya-luya, contributed significant use, answered by the participants in the survey with their trust in the efficacy of natural methods for a variety of illnesses. As for Table 8, the common herbal plants being utilized, the findings show that the highest is Lagundi or Vitex nigondo, being widely used for its proven efficiency in treating respiratory disease such as coughs, colds, and asthma. As for Table 9, it shows the reasons for utilizing traditional healing methods. 90% of the participants reported how simple it was to find herbal plants in their vicinity. Most participants responded that they favored utilizing the traditional healing method as it was accessible or readily available in the community.
So for the table 10, relationship between sex and utilization of traditional healing methods, with the highest female of 108 participants who are utilizing traditional healing method, with a male of 37 participants who utilizes traditional healing method. So there is no significant relationship between sex in the utilization of traditional healing methods. So for the table 11, the relationship between religion and the utilization of traditional healing methods, with the highest with 113 participants in Roman Catholic, with the lowest of 2 participants on Seventh-day of Adventist. So there is significant relationship between religion and the utilizing traditional healing methods, since Roman Catholics in particular are more inclined to utilize these methods, so probably for the cultural and historical reasons. And also, traditional healing methods are becoming a regular aspect of health practices in the Catholic communities.
For table number 12, relationship between educational attainment and utilization of traditional healing methods, with the top 3 educational attainment is number 1 is high school level with 45, next would be high school graduate with 27, and elementary level with 25 with the Fisher's exact test of 4.26, 6, and 0.641. For table number 13, relationship between monthly family income and utilization of traditional healing methods. Monthly family income of less than 12,000 with 114, 12,000 to 40,000 is 15, and above 40,000 is 6, with a Fisher's exact test of 0.18, 2, and 0.912.
For the conclusion and recommendation, the study on traditional healing methods in community health nursing in Hacienda Carmen, Barangay Granada, Bacolod City highlights their enduring relevance despite the availability of modern medicine. It found that traditional practices like massage, herbal medicine, and spiritual rituals remain crucial for many, especially those from lower socioeconomic backgrounds, due to their affordability, accessibility, and cultural heritage, and that there is no significant difference from all of the demographic profiles except for religion. For the recommendation, efforts should be made by the public health officials, policymakers, healthcare providers, cultural organizations, academic institutions, and future researchers to support student nurses and improve the utilization of traditional healing methods through education, policy development, and cultural competence. Collaboration among these stakeholders can enhance the integration of traditional healing practices into community health nursing, ensuring safety, quality, and accessibility for all.